Welcome to Nursing Ethics, a podcast guide to moral dilemmas in healthcare. We are a group of nursing students committed to exploring the ethical challenges that nurses face in real world clinical settings. In this episode, we'll examine three thought provoking ethical dilemmas and analyze them using the theories of the good, like utilitarianism and virtue ethics, and theories of the right, such as deontology and rights based ethics. So, let's begin.
Our first scenario deals with patient autonomy versus beneficence.
A nurse is caring for an elderly patient with diabetes who refuses to take insulin. The patient is mentally competent and aware of the consequences but insists on rejecting medical intervention.
Utilitarianism might argue that the nurse should convince the patient to take insulin for the greater good, preventing suffering, reducing hospital admissions, and ensuring the patient's overall well-being. Deontological ethics, on the other hand, focuses on the patient's right to autonomy. The nurse has a duty to respect the patient's informed decision, even if the outcome may be harmful. After discussion, we agreed that respecting autonomy is essential in nursing practice, while the utilitarian approach aims for the best outcome. Honoring the patient's choice reflects a deep respect for human dignity.
Our second scenario involves truth-telling versus protecting the patient's emotional well-being.
A nurse is assigned more patients than is safely manageable during a shift. One patient deteriorates and the nurse couldn't intervene in time.
For ethical analysis, we have theory of the good or utilitarianism. The nurse may try to manage all patients for the greatest overall good, but this often leads to burnout and mistakes. Theory of the right or deontology. Deontology would say the nurse has a duty to advocate for safe staffing, even if it means refusing unsafe assignments. For the group conclusion, we felt the deontological view stood out here. Nurses have a duty to protect patients and must raise concerns about unsafe working conditions.
As we reflected on these scenarios, our group realized that both ethical frameworks offer valuable insights. However, we found ourselves often leaning toward theories of the right, especially deontology, because nursing is grounded in duties: duty to care, duty to respect, and duty to advocate. This podcast challenged us to think deeper about our future roles as ethical decision makers in healthcare.
Thank you for joining us on Nursing Ethics on Air. We hope this episode encouraged you to think critically about the ethical dimensions of nursing care. Until next time, stay compassionate, stay ethical, and keep learning. Goodbye.